Smith & Feek. We are the insurance broker for Sound Family Medicine, and we're here to talk today about open enrollment. Who are we and why are we here? Well, again, I'm Jolie Barrier. I'm an account manager at Parker Smith & Feek. We're the benefits consultant brokers for Sound Family Medicine. We assist employees with all things related to benefits. We'll help you through open enrollment, help with confidential information that you might need assistance with related to any claims issues you might have. Well, it is open enrollment. It's that time of year where we tell you about any changes to coverages or cost. We make any changes to enrollment elections if you so choose. It's the time if you want to add or delete coverage for an eligible dependent. If you want to make any decisions on the flexible spending account or health savings account, it's that time of year to do it. And it's also the time to remind you of other benefits you may not have remembered you have. There are some changes coming in 2017. Vision coverage is still available through VSB, but it's going to be administered directly by them instead of through Guardian, and we hope that'll be a better experience for you. We have a new vendor that's going to do flexible spending. It's called Navia Benefits. We're going to have online enrollment now for any changes for open enrollment through the ADP portal. There will be some changes to the contributions toward benefits, and the plans and rates that we have starting in January will be in place now for 15 months, so they will not renew until April of 2018. Well, there is a change to the medical plan. It's a global thing for Cigna, the carrier. The cost of some allowed services, such as anesthesiology or assistant surgeons who may be out-of-network providers but who work at an in-network facility, will now have those services reimbursed at the out-of-network level. Currently, they're reimbursed at the in-network level, so what this means is there might be some more cost sharing to you. There's an example there of what this might look like. If you're planning to have some kind of procedure at an in-network facility, you might find out later that the anesthesiologist is not a contracted provider with Cigna, so you'll pay the out-of-network costs for that. Just keep that in mind. We don't think this will be a big deal for a lot of people, but it is a change globally that Cigna is making to all of their plans. So what is not changing? Again, Cigna will be our medical carrier. There are two plans. One is called the base plan. It's the high deductible or HSA Health Savings Account Qualified Plan. If you're in network, you're going to have a $2,500 per person deductible per year. There's an out-of-pocket maximum, which is $5,000 in network per person per year, and the things that go toward that out-of-pocket maximum would include the deductible up there. Remember, preventive care is always covered at 100% in network, and the coinsurance, which is the portion of the bill you pay after satisfying that deductible, is 20%, and the plan pays 80%. This is the plan that has a separate bank savings account through Optum Bank. And right now, Sound Family deposits $50 per employee per month into that account for you. Remember, all medical and prescription claims are subject to that big annual deductible except for preventive services. Here's a high-level summary of the plan. As you can see, there's also non-network benefits, but again, you'll pay a lot more out of pocket. There's also a separate deductible of $5,000 if you go to a non-PPO provider. So again, keeping that in mind, we want you to encourage you to look at Cigna providers, stay in the network. Again, the deductible applies for most services but preventive, and it also applies to prescriptions as well. The other plan is the buy-up plan called the PPO plan. This has a $1,500 individual annual deductible in network. The out-of-pocket for this plan is $4,000 in network per person per year. Again, that $1,500 will go toward that out-of-pocket amount. There are office copays. If you need to go to an office, see a provider of some kind, you pay a $35 office copay. No deductible applies. And if you have to have a major service, surgery of some kind, after satisfying the annual deductible, the plan pays 80% of the eligible charge. You pay 20%. And that's, of course, using network providers. Again, full coverage for preventive care in network, 100% not subject to deductible. Separately, there's prescriptions. There's separate copays depending on if it's generic or brand drugs. So here's a high level of the PPO plan. Again, this plan is not changing. There are no changes to the medical offerings with Cigna right now, except that one I mentioned about how certain providers will be reimbursed if they're out of network. So there is a $1,500 deductible in network. There's a separate one if you go out of $3,000. So we don't want you to do that. We want you to stay in the PPO Cigna network. Again, an office visit is just subject to a $35 office copay. No deductible applies. After satisfying the deductible, most things are paid at 80%, and you pay 20%. The prescription drug program, it's through the PPO plan again. There are 3 levels of costs. If you have a generic or what we call Tier 1 drug, you just pay a retail $15 copay. If you want to do mail order, you can get a 90-day supply for $30. We recommend you look into this, especially if you have a maintenance drug of some kind. It will save you money and it is very convenient. If you have a preferred drug, a brand drug, it's going to cost you $30. And if you're taking a drug that is not on the preferred list of drugs with Cigna, there's a $50 copay. So we really want you to make sure, look up online with Cigna the drugs you're taking, what might they be, and make sure that they are hopefully a generic drug, so it'll cost you a lot less money. Preventive drugs, there is a list of those if you're interested in that, but they are considered preventive drugs under the Healthcare Reform Act, and therefore they're covered at 100%. Something new in 2017 is something called virtual visits. It's through a telehealth connection. You can now chat with a board-certified physician, video chat, Skype, FaceTime, or phone without leaving your home or office. So certain conditions, as you see there, rash, stomach ache, pink eye, bronchitis, other infections, can be treated via a virtual visit. But mental health issues are not covered under this plan. There are 2 vendors you can choose from here, AM Well or MD Live. We recommend you go online to Cigna and register in advance of needing this service. You may never need it, but it's something to keep in mind in case you're traveling and you have a stomach ache and you don't have time to go find a doctor. You can get a virtual visit for a low copay, and you've already registered for the service, so when you go back in to say, I need to see a doctor or have a virtual visit, they'll already have your information online about that. It's a very cost-effective and, of course, time-saving alternative, but it does not replace your regular provider. Please keep that in mind. These physicians that are board certified can also prescribe needed medications, so it's a great benefit if you're traveling or on vacation. Maybe you ran out of you need a refill. They can actually then send the prescription to the nearest pharmacy for you. So what does this cost? Well, if you're on the PPO plan, it's a $20 visit, just like an office visit kind of thing. If you're on the high deductible health plan, you're going to actually pay the cost of the visit, which only ranges from about $38 to maybe $45. So much, much less than going to the ER or urgent care. But if you truly have an emergency, this is not the place to go. You do need to go to urgent care or the emergency room. We always want to make sure you're going to a Cigna PPO provider. Most efficient way to get your claims reimbursed at the highest level. So how do I know? You can go onto mycigna.com, click on Find a Provider or a toll-free number there to call and check it out. Remember, there's some great things you can have, some tips for saving money on your program through Cigna. Keep in mind you want to be proactive in your health. There's a lot of information on their website about health conditions, can answer some questions for you. As I mentioned earlier, you might want to take medications via mail order. It saves some money. Remember to use urgent care or virtual visits instead of the ER. Look up online information about cost-effective services and treatments. So all of these things are just things to keep in mind to be proactive to save both you and the plan money. So mycigna.com has a mobile app, of course, don't they all? So this is what it can do for you. You can look up a doctor, locate a pharmacy. You can view or print an ID card. If you lose an ID card and you're at the doctor's office, you can download it on your smartphone. You can view your claims, look up a drug. You're being requested to take a certain medication. What is it for? What does it mean? What does it do? What are interactions? You can look up that drug online through Cigna. It can give you some information about it. So check this mobile app out if you haven't already, but it's a great tool to have. And again, Cigna is there 24/7 for customer service help and the health information line. And if you have language concerns, there's a language line. There's the toll-free number to call. You can also go online and look up information about your plan. You can look up claims history. You can look up doctors, of course, print an ID card too, and look up frequently asked questions. And there is also something called a cost of care and quality tool. So if you're being recommended to have some kind of surgery, and you don't know anything about what that's going to cost, so what's my out-of-pocket, you can go on and you can say, I'm going to have this knee surgery, and this is where I'm going to have it done, and what is that going to cost me? So those are good things just to look into under the Cigna website. And of course, there's the mobile app there for you as well. What's not changing on the dental plan? Well, it's still with Guardian. That's the current carrier. You have 2 plans. There's a base and a buy-up available. There's no balance billing, remember, if you go to a Guardian dentist, so keep that in mind. Type 1 services in-network are covered at 100%. This is nothing new. This has not changed. This is where you go in for your cleanings, recommended cleanings, and other x-rays, preventive services, so to speak. The deductible doesn't apply if you have these type 1 services, and there is an annual maximum amount that if you don't use it at the end of the calendar year, some of it can be rolled over to the new plan. This will vary based on the plan you have and how much money you've already used. So here is a high level of the benefits through Guardian on the dental. There's the base and the buy-up plan. Obviously, the base plan has a higher deductible. It pays less, and there's an annual maximum of $1,000. The buy-up plan has a lower deductible. It pays more. The annual maximum is $2,000 on the buy-up, and there's also orthodontia there for your children under the buy-up plan. And there is some information there about the rollover amounts. Again, if you've used care in network and you haven't maxed out the annual maximums, a certain amount of that can be rolled over into the new plan year. But it varies greatly on the plan and what kind of services you've used. Vision is with Vision Service Plan. It isn't changing, but it's going to be a direct contract, so we think the experience will be better. And Costco is now a network provider, so keep that in mind. If you go to a VSP provider, you just can pay $10 to have an annual eye exam, and it's covered in full. Separately, if you decide you need to get some glasses or contacts, there is a separate copay of $25 for that. You can get a pair of lenses, that's single, bifocal, trifocal type lenses every 12 months. If you want contacts in lieu of glasses, then you can get a set for 12 months for a $130 allowance. And frames, which can be quite costly, you can get a new frame every 12 months, and the allowance is $130. So you can obviously not go to a VSP provider. There is out-of-network benefits here, but the reimbursements are much, much lower. So if you haven't used this plan or you haven't ever gone and had an eye checkup, it's a great time to check out VSP as a resource for finding the best provider for this service. So the health savings plan is through Optum Bank. This is the thing that's coupled with the high deductible health plan, the one that has the large deductible. This is a separate bank account. What is an HSA? It's a tax advantage savings account that you own, saves you money. You can use the money to reimburse for those higher health care expenses. Right now, your employer puts in $50 per employee per month into this savings account for you. What can you use the money for? Any qualified medical expense under the IRS code. Also things that the plan doesn't cover, like extra glasses, extra dental care, and things the plan doesn't cover, such as extra chiro or the deductible that you have to meet. All of those are qualified expenses under the plan. If you are in this plan, but you also want to be in a flexible spending account where you might set aside money for other expenses, you can only do that if you have a limited purpose FSA. So if you're in the high deductible plan and you want to be in the flex plan, you can only have one if it's called a limited purpose. And limited purpose means you can only have expenses that go toward dental or vision, not medical. So just keep that in mind. The great feature about these health savings accounts is, again, the money belongs to you, even if you leave the employer. You also can make contributions pre-tax up to the IRS limits. It's $3,400 for an individual next year, but remember that limit is reduced by any amounts that your employer puts in, the $50 per employee per month. And any monies that aren't used rolls over year to year to year to year. There's no limit to how much money can be in these accounts. Flexible spending account. Okay, this is the one that allows you to reimburse yourself for out-of-pocket healthcare expenses not covered by the plans, such as extra vision, extra dental, or the coinsurance or deductibles that aren't picked up because you have to pay those out of pocket. You have to make an annual pledge on that every year. This is the time to think about it. If you set aside, say, $500, and within 2 weeks of doing that, you suddenly have to use the money for an expense, you can get that money immediately. But just know that that money will still come out of your subsequent paychecks throughout the year. And also, the whole family can be in this program, even if they have coverage elsewhere. So you may not have a spouse on your health plan there now, but they might have medical expenses. And if you have money in this flexible spending account, they can get reimbursed for their expenses through your plan. The amount you can set aside next year is $2,600 per person. So that is a change. It is going up every year now, so it'll be $2,600. There are certain things you can get reimbursed by the flexible spending account and certain things that are not allowed by the IRS. And it's pretty obvious what they are. Anything that's an extra expense under the plan, you know, acupuncture limits that you might have, chiropractic limits you might have on the medical plan, you want to have more visits, those things are allowed. Any deductibles or copays you have, any dental or orthodontia services, extra contacts, prescription, all the things you pay out of pocket on the health plan now are all eligible expenses. but certain things are not allowed. So keep in mind when you're deciding how much money you want to set aside, you need to do it for predictable health care expenses. We have the other thing called dependent care, which is where you can set aside money for daycare expenses for your children. Now, to be in this plan, you have to be the custodial parent. You and your spouse must both be working full-time, looking for work, or be full-time students. In other words, nobody's staying at home to take care of children. The money is set aside tax-free. You can set aside up to $5,000 per household per year. This is no different than it's been, but that is the limit you can have. So the flexible spending plans are going to be administered now by Navia Benefits. This is a new vendor for 2017. They are located in Bellevue, Washington. If you want to be in the flexible spending account for either dependent care or health care, you have to complete an enrollment form online through ADP. Your election is good for the whole plan year of 2017. Remember, when you set aside money, to be maybe somewhat conservative, because there's these use it or lose it rules, which means if you don't use the money you've set aside, you cannot carry that over into the next year, so you lose that money. You can access the plan and benefits, look up balances, and submit claims on their mobile app. You can look up the information on how to download that app on their website there. If you do have this mobile app, you can submit a claim. You can take a photo and upload your claim to Navia. You can view pending claims or just look up history of your plan. So keep that in mind. If you're going to be in this program, you do have access to information on your phone. Well, how do I pay for these benefits? We all know that benefits are expensive and that I do need to contribute something toward my benefits here at Sound Family Medicine. So remember, whatever you contribute is going to be taken out of your pay on a pre-tax basis. There are 24 pay periods in a plan year. Majority of the monthly premiums for employees are covered by your employer, as well as some of the dependents. The majority of the premiums with dependents, depending on the plans you're in, you may pay a larger portion of that. So that gets into the important stuff, the payroll deductions. This is for 2017 on the medical plans. This is a showing of what you're currently getting out of your paycheck on a per pay period basis, 24 pay periods in a year. If you're currently on the high deductible plan, you're getting $51 and some cents out of your check. That's going to be going up to $58.50 in January. So basically about $7 more a month to be on that plan. If you're currently an employee only on the PPO plan, you're getting about $109 out of a paycheck. That's going to go up to about $126 in the renewal. And you can see, if you start studying, if you have dependents on these plans, say a spouse or children, under the high deductible health plan, the amount you're going to be having to pay for your coverages will actually be going down somewhat if you have family members on the high deductible plan. And in some cases, it might be going down as well if you're on the PPO plan. Remember, if you are a tobacco user, you will have a surcharge. So these amounts here represent if you're not a tobacco user and you participate in the wellness programs there. So if you are a tobacco user, all of these rates will go up by 15%. If you are a tobacco user and you choose not to participate in the wellness programs, which is basically you having to complete a health risk assessment every year, then the surcharge for these premiums is an additional 30%. So keep that in mind. We encourage you all to try to stop smoking and definitely participate in the wellness programs. All right, for payroll deductions for dental now, again, this is per pay period. Currently, there's a base plan and the buy-up. So if you're in the base plan as employee only, it's $3.67. If it's the buy-up plan, that's $8.23. You can clearly see by looking here at the numbers that in all cases, all of the amounts you're going to pay out of your check for dental is going to go down, which is fantastic, great news. And the plans have not changed at all. Vision, again, through VSP. Currently, your employer pays 100% of the premiums if you're just covering yourself. If you do want to have spouse children on the plan, there is a very small amount of money you pay out of your pay every pay period. So as you can see, it's actually going down slightly too. Again, this plan is something we should definitely recommend. If you have not had vision benefits before, consider enrolling in it this time. Of course, there's other benefits you get as a member of Sound Family Medicine besides the medical and the dental and the vision, and this is our chance to remind you that you get some group life insurance. It's paid by your employer. It's $10,000 per employee. If you have a spouse, there's an additional amount paid toward them and for children as well. Now, if you're interested in getting some additional life insurance, maybe you like having $10,000, but you'd really like to have more, you have some needs to increase that amount, you should look into the voluntary life insurance plans available there, because you can elect 7 times or up to $500,000 of your annual pay as voluntary life insurance. This is something you pay for, comes out of your check after tax. If you have a spouse, they can also elect an amount as long as you have coverage, and you can also look at covering some children. So something you may want to be interested in, please see HR for forms. Definitely look into it, because in many cases these voluntary life programs available through your employer through a large insurance company like this will actually cost you less than if you went to the State Farm representative down the street and said, I need some life insurance. You might find these plans actually have better benefits and cost you less. Another benefit you get working there is called long-term disability. I call this paycheck insurance. This is in that unforeseen situation where you get disabled and you cannot work. It replaces a percentage of your monthly income, 60% to a maximum of $5,000 per month after a 90-day waiting period. Again, if you are permanently disabled, depending on the severity of your condition, this plan might pay you this kind of monies up until your normal retirement age. So it's a very important benefit. Everyone should have it at work. So we have a wellness program, as you know, at Sound Family Medicine. There are biometric screenings and online health risk assessments that we encourage you to take. Again, doing those will make sure that you don't have a surcharge on your premiums for the medical plan. If you are a smoker and you really do want to quit, then there are some tobacco cessation programs through Cigna, the carrier, so look into those. Remember, any of these health screenings that you do online, it's all completely confidential. Your employer never sees that information directly. They just know if you did it. And other members can also take these biometric screenings or health risk assessments if they're interested. So your employer always gives you a reasonable amount of time to participate and complete these screenings. But if you find it's a real burdensome thing for you to do it, then they will provide some alternative methods if you cannot do these. Another benefit you get there is an employee assistance program. It's through Cigna. This is a 24/7 confidential program, a number to call where you can talk to a professional mental health counselor or even have some face-to-face visits with one if need be for those situations when you get stuck and you need some help for anxiety, there's marital issues, you've got some legal problems, you just need to talk to a counselor and you don't know where to turn. Just understand it's available to you. Your employer never knows who calls or who goes online or who actually has a face-to-face visit. It's completely confidential. So make sure you look into this program. If you want more information about it, you can see your HR department. So it is that time of year called open enrollment. So what do you need to do? Well, now's the time to decide if you need to make a change. Do you want to add or drop coverage, or do you want to add or drop any dependents on your current benefit plans? If you do, you need to go online via ADP to make any open enrollment changes. And that's only if you are making changes. Now, if you are happy with the medical and the dental plan that you have, I'm not making any changes, I'm good to go, you don't have to do anything. So we call this a passive enrollment. Only go online if you're making changes. So if you're going to move from one medical plan to the other, you do need to go online. If you want the new vision plan, you need to go online. If you're going to enroll in a flexible spending account, you need to go online. And also, if you're going to be adding monies to your health savings account, you need to go online. So all of this needs to be done no later than November 23rd. Why? Because we need a lot of time to make sure all the systems are in place and all the changes are gone through ADP so that we can make sure we get ID cards out and any other information to you in advance of January. So what's going to happen next? Well, if you do make a change to a medical plan, you will get a new ID card. Remember to replace the current cards you have with the new ones. If you do enroll in the vision plan, you will not get an ID card with VSP. They don't offer those, but you will be covered. The way that works is if you need coverage, if you need to go to a provider, you will just go online, find a provider, call the VSP provider, say I want to have an eye exam and so forth. They will check with VSP directly, confirm all your benefits. So you don't need to have an ID card when you go in there. We will get more information about those virtual visits I mentioned in the beginning from Cigna. It's a new thing, so as soon as we get more details, we'll send that off to you so you know how that works. And sometime after the first of the year, we're going to provide all the covered employees there something called a contact card. And that will have really helpful information about your plans. It'll have my name there on it as your advocate, your person to help answer questions about benefits. It'll also list your carriers, your group numbers, the websites, toll-free numbers. So if ever you're traveling and you need this information, that's a great place to go to find it. So again, if you need assistance, please give us a call. That's my contact information there. We're here as a resource to you and to your employer to help answer questions about benefits. So I want to thank you for being available to listen to the Open Enrollment 2017 presentation about Sound Family Medicine, and do reach out to me if later you have some questions about your coverages. Thank you so much.